Today we're going to be talking about something that happens to all of us pretty regularly, and that's wound infections.
Right.
And so we're going to be looking at the paper called Identifying and Treating Wound Infections, which goes into how to tell if a wound is infected and what to do next. And I'm really excited to kind of go through this with you.
Me too.
Because I feel like I've definitely made some mistakes in the past with wound care.
Yeah.
Thinking that like a little redness or something
Totally.
is totally fine.
It's part of the healing process, right?
Yeah.
That's what we always think.
So, I mean, I guess the first question would be like, we all experience, little cuts and scrapes.
Yeah.
But when does it cross the line from just a minor boo-boo into like, oh, this is infected territory?
Yeah, that's a great question because I think we all wonder, sometimes it's hard to tell.
Right.
But, one of the things you can really rely on is pain. Like pain is your body's way of telling you, hey, something's going on here.
Okay.
So if you start to have pain that's increasing, or if it's spreading beyond just like the immediate area of the cut, that's a sign that something's up.
Like going from like a little ouch to like really throbbing.
Yeah, exactly. Like a throbbing or a pulsing pain.
Okay.
That's not a good sign.
Got it.
Also, visually, like if the redness is spreading beyond just the immediate area of the wound, that's also a sign that maybe there's an infection brewing.
So it's fine if it's a little bit red right around the wound, but if it starts to expand.
Exactly.
Okay,
Yeah. And of course, pus, drainage from the wound, a little bit of clear fluid maybe in the first day or two is okay. But if it's getting, thick or yellow or green.
Oh, yuck.
Yeah. That's a sign that there's bacteria there.
Ooh, okay. So redness, spreading pus.
Yeah.
Are there other signs, too, that we should be looking for?
Yeah. There are some things that maybe aren't as obvious, like increased warmth around the wound.
Oh, yeah.
Can be a sign of inflammation. Or if it's really slow to heal.
Okay.
That can be a sign that something's off.
Okay.
And then sometimes even, you'll have more systemic, like all over body symptoms.
Right.
Like you might get a fever or chills, or your lymph nodes might be swollen.
Oh, wow.
Which are those little glands that help fight off infection.
Okay.
So those can be signs too.
So it can really affect like your whole body.
It can, yeah. It's all connected.
So how do we know if it's just like normal inflammation as part of the healing process?
Yeah.
Or if it's like, okay, this is definitely an infection that needs to be taken care of?
Yeah, that's a really good question. And the paper actually goes into this in detail in the section called Distinguishing Between Normal Healing and Infection.
Perfect.
And so, in the first couple of days after you get a wound, it's normal to have some redness, some swelling,
Right.
maybe a little bit of clear fluid.
Yeah.
And of course, there's usually some pain and tenderness, but it's when those things, don't start to get better after a few days, or if they actually get worse, that you start to worry.
Okay. So it's really about like looking for changes.
Yeah, exactly.
If it's staying the same or getting worse.
Yeah. And paying attention to your body. Your body will often tell you if something's wrong. So if it feels off, it probably is.
Okay. So let's say we're seeing some of these signs like it is not looking good.
Okay.
What's the first step? Should we be like rushing to the emergency room, or are there things that we can do at home to start addressing it?
Yeah. So not every infection needs a trip to the ER right away.
Okay, good.
There are definitely things you can do at home to manage a mild infection and promote healing.
So what are those things?
So first things first, clean the wound.
Okay.
And I know this seems obvious, but it's really important to do it right.
Okay.
Wash your hands really well with soap and water before you touch the wound.
Got it.
Because you don't want to add any more bacteria to the mix. And then you want to gently clean the wound with just some mild soap and water.
Okay, so not like those harsh antiseptics that I feel like our parents used to use.
Yeah, exactly. You want to skip the hydrogen peroxide.
Oh, okay.
And the rubbing alcohol, because those can actually damage the tissues.
Interesting.
And slow down healing.
Okay.
So just gentle cleansing with soap and water.
Got it. And then once it's clean?
Once it's clean, pat it dry with a clean cloth or a gauze pad. And then apply a thin layer of antibiotic ointment.
Antibiotic ointment is always a good idea.
Yeah, it can help.
Okay.
It helps to keep the wound moist, which is important for healing.
Okay.
And it also creates...
Or let it air out.
Yeah, it's generally best to keep wounds covered with a bandage, especially for the first few days.
Okay.
That helps to protect it from dirt and bacteria. And it helps to keep that moist environment that promotes healing.
Okay, so bandage is good. All right, so we've cleaned it. We've got the antibiotic ointment on it. We've got it bandaged. What else can we do at home to help it?
Well, warm compresses can be really helpful. So
Yeah.
you just want to take a clean washcloth,
Mm-hmm.
soak it in some warm water,
Mm-hmm.
and apply it to the wound for like 15, 20 minutes a few times a day.
Okay, so what does the warm compress do?
It just helps to increase blood flow to the area,
Okay.
which helps to bring those white blood cells that fight infection.
Okay.
And it helps to kind of carry away any waste products.
Okay.
So it just kind of helps speed up the healing process.
Mm-hmm. And what about keeping it elevated if it's like on your arm or something?
Yeah, elevating the injured area can definitely help.
Yeah.
It helps to reduce swelling and it can promote drainage. So that's always a good idea.
Okay, cool. And I know we've also talked about like overall health being really important too
Oh, absolutely.
for healing.
Yeah, your body needs all the right nutrients to be able to repair itself.
Right.
So make sure you're eating a healthy diet, getting enough sleep, staying hydrated.
So it's kind of a whole body approach.
Exactly. It's not just what you're putting on the wound, it's what you're putting in your body.
Yeah.
Yeah.
Okay, so we're keeping it clean. We're doing the compresses. We're taking care of ourselves.
Yeah.
But when do we know that, okay, this is not working? I need to actually see a doctor.
Right. So there are some definite signs that you should seek medical attention.
Okay, what are those?
So if you start to see red streaks spreading out from the wound,
Okay.
that's a sign that the infection is spreading.
Okay.
And that can be really serious.
Red streaks are bad.
Red streaks are bad.
Yeah.
If you develop a fever,
Mm.
if the pain is really severe,
Okay.
or if the wound is very deep, or if it was caused by something dirty or rusty,
Right.
those are all reasons to see a doctor.
So if you have like a puncture wound
Exactly.
from like a nail or something,
Yeah, or an animal bite.
right? Animal bites can be really bad.
Animal bites are definitely a reason to see a doctor.
Okay. And are there certain things that make people more susceptible to getting a wound infection?
Yeah, there are definitely some risk factors.
Okay.
So if you have diabetes,
Mm-hmm.
if you have any kind of condition that affects your circulation,
Okay.
like peripheral artery disease,
Mm-hmm.
if you have a weakened immune system,
Right.
for any reason, like if you're taking certain medications or if you have HIV,
Mm-hmm.
those things can all increase your risk.
So it's good to be aware of kind of your own personal risk factors.
Absolutely, yeah.
Okay, so we've talked about what an infection looks like. How to know if you need to see a doctor. Are there things that we can do to prevent infections in the first place?
Yeah, absolutely. Prevention is key.
Okay.
So you always want to clean wounds promptly and properly.
Okay.
Even those little cuts and scrapes,
Yeah.
just take a minute to wash them with soap and water.
Yeah.
Keep them covered with a clean bandage.
Mm-hmm.
Wash your hands before and after you touch a wound.
Okay.
And make sure your tetanus shot is up to date.
That's a good one. I haven't thought about that in a while.
Yeah, tetanus is no joke.
Okay, so those are kind of the golden rules of wound care.
Yeah, I think so.
What else? I mean, are there other things that we should be doing just to kind of keep our wounds healthy and happy?
Well, just being mindful of your surroundings.
Okay.
If you're working with sharp objects, wear gloves.
Okay.
Be careful when you're handling animals.
Right.
Just kind of common sense things like that.
So being aware.
Yeah, exactly.
Okay, well, I think we've covered a lot of ground in this first part of our deep dive.
We have.
We've talked about how to spot an infection, when to see a doctor, and some really great prevention tips.
Mm.
But we're just getting started.
Yeah.
In the next part of our deep dive, we're going to be talking about specific types of wounds, like burns and puncture wounds.
Right.
And we'll delve into some of the more advanced treatments.
So really cool stuff. Like
Yeah.
negative pressure wound therapy and bioengineered skin.
I'm excited for that. So stay tuned, deep divers. We'll be right back.
We'll see you soon. So, welcome back, deep divers. Ready to get down to the nitty-gritty of some more specific wounds?
Absolutely. In the last part, we talked about like those basic cuts and scrapes.
Yeah.
But what about when things get a little more intense, like when you have a puncture wound or an animal bite?
Yeah, those are definitely a different beast altogether. Remember how we were talking about a wound being like a battleground?
Right.
Well, with the puncture wound, it's like that battle's happening, deep underground.
Oh, okay.
So you're not just dealing with the surface damage.
So like if you step on a nail, for example.
Exactly. You've got that little puncture hole in your skin. But the real danger is all the bacteria that nail dragged down into those deeper tissues.
Oh, so it's trapped down there.
Yeah, and to make matters worse, puncture wounds often close up really quickly on the outside, so it's like those bacteria are having a little party down there.
Oh, that's not a party I want to be invited to.
No, definitely not. And so that's why it's so important with any puncture wound, even if it seems minor, to go see a doctor.
Okay.
Because they can clean it out thoroughly, and in some cases, they might even prescribe antibiotics to prevent infection.
Okay, so even if it's just like a tiny little prick from a sewing needle, it's still worth getting checked out.
It's always better to be safe than sorry with puncture wounds. Now, animal bites, those are kind of their own category of wound.
Yeah, I mean, animals' mouths, they're not exactly known for being like the cleanest places.
No, and even a bite from, your own pet can introduce a lot of bacteria into a wound.
Mm-hmm.
And those bacteria can cause infections.
Right, and then you've got like the wild animal bites, which are even scarier.
Right, because with wild animals, there's a much higher risk of infection. Plus, there's always the concern about rabies.
Rabies, that's like the stuff of nightmares.
It is serious. It's a viral infection that affects the nervous system.
Oh, wow.
And if it's not treated, it can be fatal.
So puncture wounds, animal bites, those are definite see a doctor situations. What about burns? Because, a burn isn't exactly an open wound in the same way as a cut, but they can still get infected, right?
Absolutely. Burns pose their own challenges when it comes to infection control. Because when you have a burn, you've essentially destroyed that protective barrier of your skin. So it's like an open invitation for bacteria to just walk right in.
Right. And I imagine like the severity of the burn matters too.
Oh, yeah, definitely. The more severe the burn, the greater the risk of infection. So if you have a burn that's like blistering or charring the skin, that's when you're really vulnerable.
So if you get a burn, what's the best way to take care of it at home?
Well, the first thing you want to do always is cool the burn. So hold it under cool running water for at least 10 to 20 minutes.
Okay.
And no ice, no butter, like, those old home remedies. No,
Yeah.
just cool running water. And then after you've cooled it, you want to gently clean it with mild soap and water and pat it dry.
Okay. And should you cover it with a bandage?
It depends on the severity. If it's a minor burn, you can often leave it uncovered. But if it's a larger burn or a more severe burn, then it's best to cover it loosely with a sterile nonstick bandage.
Okay.
And you want to make sure you change that bandage daily or even more often if it gets wet or dirty.
Okay, so when would you say a burn is like serious enough to warrant a trip to the doctor?
So if the burn is larger than 3 inches in diameter, or if it involves the face, hands, feet, genitals, or a major joint, then you definitely want to go see a doctor.
Oh.
Also, if it looks deep or charred.
So if you're kind of questioning it, it's better to just go get it checked out.
Always a good idea. Now, let's circle back to those everyday cuts and scrapes, the ones that we might be tempted to just kind of ignore.
Oh, yeah, I've definitely been guilty of that.
But even those minor injuries really deserve proper care. Because any break in the skin, no matter how small, is a potential entry point for bacteria.
Okay, so can we just quickly run through those essential first aid steps again?
Sure, so the first step, always, 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 wash your hands thoroughly with soap and water before you touch the wound.
Clean hands are key.
Absolutely. Then you want to gently clean the wound with mild soap and water. Rinse it well.
Again, no harsh antiseptics, right?
No hydrogen peroxide, no rubbing alcohol.
Got it.
Okay, once the wound is clean, pat it dry with a clean cloth or gauze pad.
Okay.
Now, if the wound is bleeding, you want to apply gentle pressure with a clean cloth or gauze until the bleeding stops.
Okay.
Once the bleeding is under control, you can apply a thin layer of antibiotic ointment.
So antibiotic ointment, is that always necessary or is it more for like deeper cuts?
It's not always strictly necessary for like a tiny little scratch, but it can definitely help to prevent infection and promote healing, so it's generally a good idea.
Okay.
And then, of course, you want to cover the wound with a bandage.
Right.
And make sure the bandage is slightly larger than the wound, and you apply it snugly but not too tightly. You don't want to cut off circulation.
Right. And how often should you be changing the bandage?
So it depends a little bit on the wound and how much drainage there is. But generally, changing it once a day is a good rule of thumb. And of course, if it gets wet or dirty, you want to change it sooner.
Okay.
And each time you change the bandage, you want to take a look at the wound just to make sure that there are no signs of infection.
So a little wound inspection.
Exactly. So we've cleaned the wound, we've applied antibiotic ointment, we've got a bandage on there. What else can we do at home to kind of help it along?
Yeah, what else?
Well, keeping the wound clean and dry is really important.
Right.
And as we mentioned earlier, for most wounds, it's best to keep them covered with a bandage, at least for the first few days.
Okay.
Now remember, wound care isn't just about what you're doing on the outside. It's also about taking care of your body from the inside.
Right. We talked about overall health in the first part.
Absolutely. Your body needs all the right nutrients to be able to heal properly. So make sure you're eating a balanced diet that's rich in protein, vitamins, and minerals.
So all those healthy foods are good for more than just our waistlines.
Exactly. And of course, we can't forget about hydration. Water is crucial for all bodily functions, including healing.
And what about rest? Is rest important too?
Absolutely. Rest is essential. Give your body that time to focus its energy on repairing that wound.
Okay, so it's really a whole body approach to wound care.
Exactly. Now, in the next part, we're going to tackle some of those trickier situations, the wounds that just don't seem to want to heal.
Ooh, those stubborn ones. I'm intrigued.
It's going to get interesting. So join us next time as we delve into the world of chronic wounds and explore some of those cutting-edge technologies that are really changing the game in wound care.
Awesome. Can't wait. Our deep divers, welcome back for the final part of our deep dive on wound infections.
It's been quite a journey, hasn't it?
It has. We've talked about so much, from identifying infections to first aid to prevention. But now I want to get into something that I think is really interesting, and that's those wounds that just won't heal.
Yeah, the chronic wounds.
The chronic wounds, exactly what makes a wound go from just taking a little bit longer to heal to, like, this is a chronic problem.
Well, a lot of times it's because there's something else going on underneath the surface, some underlying medical condition that's making it harder for the body to heal.
Okay, like what kind of conditions?
Well, diabetes is a big one.
Okay.
High blood sugar can really impair the immune system and slow down healing.
So it's not just about managing blood sugar for your overall health, but also for wound care specifically.
Exactly. And anything that affects circulation, like peripheral artery disease,
Right.
can make it harder for those, infection-fighting cells to get to the wound.
So it's like a double whammy. Your body's not fighting as well, and it can't get the reinforcements there as quickly.
Great. And then certain medications can also interfere with healing, like corticosteroids or chemotherapy drugs. Those can suppress the immune system.
So it's this balance between managing the condition and also trying to help the wound heal.
Exactly. And that's why it's so important to work with your doctor if you have a chronic wound.
To figure out what's going on.
Yeah, to get to the root of the problem.
So medical conditions, medications, are there other things that can make a wound become chronic?
Yeah, sometimes it's just the nature of the wound itself, like where it is on the body.
Okay.
If it's over a joint that moves a lot,
right,
that can make it harder to heal, or if it's a very large or deep wound.
So for these more complicated wounds, are there like high-tech treatments out there?
Oh, yeah, there's some really cool stuff.
Okay, tell me about it. I'm fascinated.
Well, one of them is called negative pressure wound therapy.
Negative pressure wound therapy.
Yeah, it's also called vacuum-assisted closure.
Okay, I've heard of that. What is it?
So they basically create like a vacuum seal over the wound.
The vacuum seal.
Yeah, using a special dressing and a pump.
Okay. And it helps to draw out excess fluid and bacteria from the wound.
So it's like sucking all the bad stuff out.
Yeah, exactly. And it also helps to pull the edges of the wound together.
Oh, wow. So it's like helping it close up faster.
Yeah, and it's been shown to be really effective for all sorts of chronic wounds.
That's amazing. What else?
Well, there's this whole field now of bioengineered skin substitutes.
Wait, lab-grown skin?
Yeah. Basically,
crazy.
They can take sheets of living cells and apply them to the wound
to
help promote new tissue growth.
So it's like giving your body a jump start.
Exactly. And they can use cells from different sources, like human cells or animal cells, or even synthetic materials.
Wow, that's incredible. And what about stem cells? I hear those are being used for a lot of things now.
Yeah, stem cells are really interesting because they have the potential to become any type of cell in the body.
Right.
And so researchers are looking at how to use them to regenerate damaged tissue in wounds.
So that could be huge.
Yeah, it's a very promising area of research. That's amazing to think about. It seems like there's so much hope, even for those really difficult wounds.
Absolutely. There's always something new on the horizon.
Well, deep divers, we've come to the end of our journey into the fascinating world of wound infections.
It's been a pleasure exploring it with you.
We've covered so much, from the basics of wound care to the latest advancements in treatment. And I hope you've learned something that you can use in your own life.
Me too.
Whether it's being more proactive about preventing infections or knowing when to seek medical attention.
The knowledge is power.
It really is. So stay curious, stay informed, and keep those wounds clean and happy.
Until next time, deep divers.